Hi, and welcome to the YouTube channel. Today we're diving into a crucial topic in mental health care, how to choose the right tapering method for your psychiatric medication taper. And if you are considering tapering off your psychiatric medication, or you just want to learn more about the process, you're in the right place, because we're going to be discussing different tapering methods, including dry cuts with tablets, and 3 unique types of liquid tapers, and also the detailed technique of bead counting. Also, it is vital to remember that tapering off medications should always be done under the guidance of a healthcare professional. Our aim is to arm you with the knowledge so you can make informed decisions in consultation with your doctor. If you find this video helpful, don't forget to like, share, and subscribe for more tips on how to best taper your medications. Let's get started. Okay, so now we're going to go over all of the different tapering methods, and we're going to cover the pros and cons of each method to help you pick the one that's right for you. So you may not have known that there's a lot of ways to come off psychiatric medications. We've got things like dry cuts, which is essentially getting the tablets and then shaving them down with a razor. And for a lot of tablets, you can do this. Some different tablets have special coatings and you can't do it, but for a lot of them you can. With liquid tapers, there's 3 different types. You could get a pre-made one from a pharmaceutical manufacturer that comes in a set concentration, or you could get a compounded liquid from a compounding pharmacy that they make custom for you according to the concentration that you want. Or you could do a water taper, and this is where you can actually dissolve some tablets in water or milk at home and then make your own essentially liquid compound and taper with that. We're going to go over all of these. And then finally, we have the bead counting method, which is used for difficult to taper drugs like extended release Effexor or Cymbalta, where you really can't modify the beads or turn them into a liquid or anything like that. You have to kind of remove beads bit by bit during the taper. Let's start with dry cuts. So the pros and cons. The pros, you don't need to change from what you're already on. Frequently people, they'll be taking like Lexapro in a tablet, and you can just dry cut with that tablet. You may be on Valium tablets or Klonopin tablets. You could just start shaving them down with a razor, and you don't really need to do anything. You just get what you've got and start tapering. The nice thing about tablets is they have a really long shelf life. This can be helpful if you're traveling or you're moving around a lot. Some of these tablets, they last up to a year, sometimes longer. And it's not really confusing for your doctor. I mean, if you were telling your doctor, hey, I'm just tapering off this, I'm just shaving bits of the tablets off, they go, okay, that's fine. And they just keep on prescribing it to you. It's not overwhelming for them. Let's talk about the downsides to doing the dry cuts. Well, it takes time to do. Each day you're pulling out a little tablet, kind of shaving it down, and you're using a scale to measure it. The entry-level scales are not that precise, and what this means is you can only really do cut and hold when you're doing these dry cuts with an entry-level scale, and that means that you would drop kind of 5% every 14 to 30 days. That's about the level of precision you could get. But if you wanted to do a micro taper with dry cuts, you would need to buy a more expensive scale that cost about $400, and it's a little bit more fiddly then. That way you could do maybe like a 1% cut every 3 days or something like that. To do the dry cuts, these are the things that you would need. You would need to get a box of razors. Some people use nail files as well to kind of shave down the tablets, or they use like an emery board. All of this is pretty cheap. There's an entry-level scale that people use called a Gemini. It's available on Amazon. And then there's more advanced scales where they go back an extra decimal point, and you just get this really nice level of precision. Moving on now, so we're going to talk about manufactured liquids. There's a lot of antidepressants of the benzodiazepines come with manufactured liquids. So Xanax does, Prozac does, Lexapro does, Valium does. They're available in preset concentrations, and depending on where you are in your taper, you could use these. And the advantages of that is, 1, it has a really long shelf life. A lot of the times these things last for up to a year. And 2, they're easy to get because they're pre-made. You could get them at your local Walgreens, CVS. Probably the one downside of this is you can't pick the concentration. So that makes it harder sometimes to do smaller reductions, where maybe you want something that's a little bit more dilute, but it's easier to do the reductions with a syringe. You just don't have that flexibility with the manufactured liquids. And let's move on now to the compounded liquids. Personally, this is what I use for the most of my patients. I find this one is the most flexible and the most useful. Because it's fully customizable, I can prescribe it in whatever concentration I want. I can design it in a way where it's really easy to lower the dose on a daily basis with syringes. It's also really fast to do when you set it up that way, and it becomes really effortless. In general, however, it has a short shelf life. This method is really good if you're not traveling too much, or when you do travel, you don't go away for any longer than 10 days, because usually about 14 days is the shelf life. Other cons, you have to use a compounding pharmacy, and this can be moderately expensive to do because it's more custom for you. So you're going to spend between 50 to 80 US per month to get this done. And the final liquid method we're going to talk about is the water taper. The pros of this is that it does not require high physician involvement. I mean, I'm always going to recommend that you tell your doctor that you're tapering so they can oversee it. But I know of a lot of people who have done this and the doctor never knew, because the doctor just keeps on prescribing them the tablets. They may dissolve a tablet that they're taking on a once a day dosing in 300 milliliters of water. And then each day they just progressively remove a 1 milliliter from that solution and drink it. And then over 30 days, they've gone down 30 milliliters. It's a 10% reduction. And it's just like a really easy way to make your own, compound it at home. Because you're using tablets, there's a long shelf life. You could travel and do this because you can dilute it to any strength that you want. It can be very easy for like micro tapers. But there are some downsides to this. The downsides are a lot of these tablets, they're not fully soluble in the water. What it looks like when you dissolve them, it's almost like a dirty, sandy mixture in water. It's hard to know really whether the active drug has fully dispersed in all areas of that liquid. When you're removing that little amount each day from the water, there's a lack of precision there. Some people will get around this by kind of swirling the mixture just before they kind of remove it, but there's a little bit of a precision problem there. And that's probably not a big deal if you're tapering stimulants or drugs like Wellbutrin, but I also know of a lot of people who have done drugs like Klonopin or Valium or Xanax, where you do think you need more precision, and they've done just fine with the water taper, even with the lack of precision. The other downside is this can be time consuming as well. Dissolving tablets, it might take 15 minutes to dissolve the tablet, kind of shake it up, remove the amount. If you have 3 times a day dosing, you'd kind of pour the liquid into 3 separate containers and store it. So it is a more time consuming method. And finally, we've got the counting beads approach. Honestly, I don't think anyone would choose to do this method. It's something that's kind of just like forced on you when you have a difficult drug to taper, something like Cymbalta or the extended release Effexor. However, if you did have extended release Effexor, this comes in a tablet, so you might just want to transition over to the tablets, because at that point, you could do a water titration, or you could also get the Effexor turned into a compounded liquid. So really, bead counting is more of a Cymbalta thing. It can be reasonably precise. A lot of these capsules, they'll have over 100 little beads in there, and you just kind of slowly remove each bead as you go. It's time consuming, and in order to do this, you'll need a couple pieces of equipment. You're going to need a clear capsule to kind of put the new dose into. You're going to need a counting surface, usually just a black piece of fabric, and a counting tool like a nail file. You just remove more and more beads at whatever interval you've chosen, whether it's every 7 days or every 14 days or every 30 days. In conclusion, in terms of tapering methods, here's what I would say. Liquid compounded tapers are the easiest and the most versatile for antidepressants and benzodiazepines. I love this because it's also easy for your doctor. They can just prescribe that same liquid compound, and then you adjust everything. It's not like you're calling them up if you're doing compounded capsules and saying, hey, I need you to order this new capsule from the compounding pharmacy. They don't need to do anything. They just keep on refilling it, and then you can completely adjust it to your wish. I'd start with a liquid compounded taper if you can. After that, dry cutting with scale. When would you want to do dry cuts with scales? Well, this is more time consuming, but I've seen people who want to stay on their brand of drug do this. Let's say you're tapering off the Teva brand of lorazepam or something like that, and you just know you tolerate that one, and you've tried to transition to other ones and it hasn't worked, and you're just afraid of going to a liquid formulation because you just know that you like Teva. In that instance, do dry cuts. You can keep your Teva brand and you can just slowly shave little pieces of that off. When you need additional precision, you can go and get a more powerful scale. If that's you and you resonate with that, I would consider doing dry cuts. And then water tapers are really commonly used in the community. There's something about them that just seems a little less precise, but honestly, a lot of people have had great success with them. They're great if you don't have access to a compounding pharmacy and you want to micro taper. It's also cheaper. I mean, if this is working for you and you don't have to pay, 50 to 80 bucks a month just by like putting your Valium in water and dissolving it and doing it that way, then that's great. It also has a long shelf life. So that is my overall review of the different tapering methods, and hope that was helpful. And that's it. I hope this video makes your tapering journey a little more manageable. If you're looking for someone to help you with your psychiatric drug taper, we work in several states in the US, and all of these are listed on our website in the link below this video. Thank you so much for watching, and take care.